George, thank you very much. Good evening, ladies and gentlemen. The word hospice has the capacity to evoke many powerful and often conflicting emotions. Hospice care is primarily concerned with life and living, yet it is most frequently associated with death and dying. The word hospice contains many inherent contradictions. It has the capacity to create great hope, great inspiration, great support, and at one and the same time has the capacity to instill enormous fear and a great sense of foreboding. The subtitle of this presentation, War and Peace, is not intended to alarm you or alert you about the planned duration of the presentation this evening, but rather to highlight a fact that's little recognized and rarely acknowledged, and that is that modern hospice care came about because of a chance meeting between two people. David Tasman, a young Jewish man from the Warsaw Ghetto, and Cicely Saunders, at the time a social worker at St. Thomas's Hospital in London. It is the case that had war not broken out, neither would have been in that place at that time. But I want to fast forward to the year 1986 and take you in my shoes. I was a young doctor. I just started my training in hospice care at St. Christopher's when I met this lady, Sarah. And over the course of the 8 weeks that I and others worked with Sarah and her family, I learned everything I needed to know about hospice, about healthcare, about humanity, and about myself. Our patients are our greatest educators. And Sarah was a young woman. She was 32. She was a married lady with 2 young children, aged 5 and 7. She had advanced breast cancer, and her life expectancy, sadly, was measured in weeks. When Sarah came to the hospice, she was utterly despondent. She had lost all confidence. She described herself as being bald, fat, and ugly. She wrestled with the ultimate questions. Why was this happening? In the hospice, we were not in a position to provide answers, but rather we created the space. We created the opportunity whereby Sarah could find her own answers, and she did. And very gradually she picked up at least the threads of her life. She reaffirmed her role as a mother, as a wife, as a daughter, as a sister. And the hospice, we held the space. When I came back to Cork in 91, I came back to a post at Marymount Hospice. At that time, it was housed in this beautiful building on the north side of Cork City, St. Patrick's Hospital. Just last year, we moved to this stunning new facility on the western suburbs. A classic facility that more than meets the varied complex needs of our patients and their families. But this is the social worker I referred to, Cicely Saunders. When Cicely left school, she went to read humanities at Oxford. And with the outbreak of war, she thought, I really need to do something more practical. So she trained as a nurse. And as a nurse, she observed horrendous distress, horrendous suffering. She wrote afterwards how she observed patients having to earn their morphine. The doctors of the day, as of now, had an exaggerated sense of the fear and concern about the adverse effects of these agents, and very little appreciation of the potential benefit. Cicely's career in nursing was cut short because of a back injury, but wanting to maintain her contact with patients, she trained as a social worker. And it was in that capacity that she met this gentleman, David Tasman. And she wrote afterwards, my story goes back to 1948, when I was a social worker, meeting a young Jew who had inoperable cancer. David had no family in the UK, he had very few friends. She said in a somewhat understated way, I became quite fond of him. And together they explored the needs of dying patients, the need for pain control, for symptom control, but it was way, way greater than that. There was a need for emotional care, for social care, for spiritual care. And sitting with David one day, he asked her to say some words that would comfort him. And respecting his Jewish tradition, she recited Psalm 23. The Lord is my shepherd. And having exhausted her repertoire of psalms, he asked her again, can you say anything to me that will help me? And she said, well, what do you want? And he uttered the words that have defined hospice medicine and palliative care ever since. He said, I want what is in your mind and in your heart. Meaning, I want the very best that scientific medicine has to offer, but I want care that's sympathetic, that's compassionate, that's empathic, that's intuitive. It's not good enough to have one without the other. We need the mind and the heart in hospice care and in healthcare. And after David's death, Cicely started to think and reflect, and she wrote, and she said, I realized that we needed not only better pain control, but better overall care. We need to create the space for patients to be themselves. We need patient-centered care. She said, you matter because you are you, and you matter all the days of your life. And taken from a letter she wrote in 1951, she said, I've become more and more aware of the problems of the dying, particularly of the hopeless advanced cases of cancer. I do think they are deserted by the doctors, and I want to find ways of alleviating their physical and mental distress. And Cicely sought advice from her consultant colleagues, and she was told, if you want to work with the dying, go read medicine. It's the doctors who desert the dying. And now, in her early 30s, she took up that challenge. She went back and she trained in medicine, qualifying in 1957. She did her early work at St. Joseph's Hospice. She established a scientific basis for her specialty. She presented a series of 900 patients, demonstrating the safety and the efficacy of opioid medication to the Royal Society of Medicine back in 1962. And rarely, unusually, I would say, uniquely perhaps, for a young medical graduate, within 10 years of her qualifying, she opened her own institution, St. Christopher's Hospice here, the first of the modern teaching and research hospices. And this was what she and David Tajma had dreamed about, had fantasized about, opening a home where the needs of these patients could be comprehensively and properly addressed. And David's contribution to that is captured in this plaque, which is on display at the hospice. It says, I will be a window in your home. The promise of David Tajma of Warsaw. David, when he died, left everything he had, a few £100s, to Cicely. And she applied that as the first contribution. It wasn't the only contribution, it was the first contribution that helped her open St. Christopher's. And there, working with colleagues, Mary Baines, Tom West, many others, they developed the concept of total pain, recognizing that pain is not just a physical phenomenon, and the interconnectedness of these various elements, what's happening in our mind, in our emotions, our spiritual well-being, and so on. And the capacity of these one to influence the other was identified and recognized. And this was captured in more recent writings by Lickis, where she describes the difference between disease and illness, a concept that's not always given adequate attention. Disease, of course, being a pathological reality, whereas disease is subjective, it's experiential, and it's always contextual. It always arises in the context of the unique circumstances of an individual's life. And if you came here tonight thinking you only have one life, you're wrong. You have 3 lives. You have a past life, you have a present life, and you have what is generally described as an anticipated future life, whether that is clearly defined or maybe less clearly defined in your own mind. And this concept of the 3 lives of man is very important, because in hospice care, when we meet a patient, we need to get some sense of that person. We need to know their past, what they choose to reveal of themselves, the present issues, and the anticipated future issues. If you're in Amsterdam, it's well worth taking a little time to visit the Van Gogh Museum, and you'll see this beautiful, beautiful painting. And it fascinates me, he didn't go for a new pair of boots, shiny out of the box. Rather, he picked boots that had seen better days. They'd been around the block a few times. And sitting looking at those, you can imagine the stories they have to tell. And I often draw a parallel when we meet a patient maybe who's 86. And I think to myself, he didn't just become 86. At some stage he was 6 and 16 and 26 and 46 and 66 and so on. And we need to give people the opportunity in healthcare to tell their story. And we need to listen to that story attentively, and we need to try to understand it. And of course, at the very end of life, those three elements coalesce into one very, very sharp focus. So all the issues from the past, the hurt, the resentments, the bitterness, all this unfinished business is now. The present is now. The anticipated future, such as it is now. And Sarah understood that. And she made provision, for example, for her children's education. And she wrote letters to her children they would open at various stages along their lives. The anticipated future. And this is nothing new. This was said to us by Osler. Going back in time, Hippocrates. It is more important to know the person who has the disease than the disease the person has. But how is that applied and implemented in the generality of healthcare provision? Let's look at some things that are said and written. These are very, very harsh words of criticism. Patients experiencing coldness, resentment, indifference, contempt. And you wonder, is this some kind of crank? But it's a rather sobering thought to see this is taken from a speech delivered by Jeremy Hunt, the Health Secretary in the UK, to the King's Fund in London just in the past few weeks. What has gone wrong? What is happening? And let's look at a patient account. And this is a particularly interesting one because this man, Kieran Sweeney, was Professor of Medicine at the Peninsula Medical School in Exeter. And he developed a cancer of the lining of his lung. And he wrote of his experiences. And it was published in the British Medical Journal just a few short months before he died. And he talks about being a patient, and he talks about leaving the kingdom of the well. And that's a reference to work by Susan Sontag, where she describes the kingdom of the well and the kingdom of the sick. And we all hold dual citizenship. And most of the time we travel on the good passport. But every now and again, every one of us is required to travel on the other passport. And that's a more difficult place. And Kieran describes how he encountered impressive medical technical competence, faultless, but undermined by a hesitation to be brave. He tells us how he learned his diagnosis from reading his own discharge summary. And he describes sitting around with his wife and his 4 teenage children. And he says, I can't describe in words the catastrophic hurt I have inflicted on them. We embrace, they weep. I weep for them and for myself. And he describes the unthinkable horror that they will inhabit a world in which I play no part. The anticipated future, or the pain of not being there. He describes how the relational aspects of his care lacked strong leadership. What I always feared in illness was anonymity, being packaged, losing control, not being able to say, this is who I am. And that's a great challenge for healthcare providers. We need to create the opportunity whereby people can say, this is who I am. And sadly, he concluded his piece by saying, in the end, one is left alone here in the kingdom of the sick. In this country, we've had this very recent ESRI report, which celebrates progress as evidenced by a drop in the average length of hospital stay. Patients here are being treated faster than ever before. This is a reflection of efficiency, impressive efficiency, and indeed the HSE deserves some credit. But you know something? When I'm in the kingdom of the sick, I don't necessarily want to be treated faster. I want to be treated better. And Cicely Saunders knew a lot about this. This is a photograph taken of Cicely at St. Joseph's Hospice in the early mid-1960s. And this was a time in hospitals where visitors were welcome, where ladies wore hats, where doctors wore white coats, and where flowers were allowed. So that dates it pretty much, doesn't it? But Cicely knew about the importance of meaning, which is the hallmark of spirituality. And an inability to find meaning is the characteristic of spiritual anguish and spiritual pain. And Cicely reminds us that the cry of loss may not want or expect an answer, but only a silent listening. Or as Michael Carney has written, maybe slightly more focused way, being present with silent attention. And I'm not certain how often patients in our healthcare system experience that from their clinicians, that their clinicians are present to them with complete, absolute, respectful, silent attention. In watching, we should learn not only how to free patients from pain and distress, how to understand them and never let them down, but also how to be silent and how to just be there. My mother used to say to me, "Don't just sit there, do something." I thought that was good advice. My professional life has taught me, in fact, it's much more difficult, but much more meaningful to don't just do something. Sit there. After Sarah died, her dad wrote a letter. And in that letter, he captured much more clearly, much more succinctly, much more eloquently than I could ever do the meaning of hospice. He said simply, "Between you at the hospice, you gave her back her life." A remarkable thing to say in respect of somebody who had died just a few short weeks earlier. You gave her back her life. And if Cicely were here, I know she would want the last word. She always had the last word. Life is above all about learning to love. And most of us have merely begun when we die. Thank you.